Responsible for over 500,000 deaths, now at a rate of over 175 people a day, the opioid epidemic is a national crisis. Using publicly available data, we are able to start to understand pieces of this problem. How have opioid deaths increased over the last 15 years? As you can see in the county overdose bar graph, in 2000 there were only 2 counties that had over 28 deaths per 100,000 people: Rio Arriba, New Mexico, and McDowell, West Virginia. In 2015, there were over 400 counties that had over 25 deaths per 100,000 people. If we just look at the over 30, we can see over 151 counties, mainly in New Mexico, West Virginia, Kentucky, Virginia, and Nevada. If we want to see the progression over time, you select Time Forward. We can see how some states and neighboring counties and other states have been taken over by the epidemic. If we go to Bland County, Virginia, a neighboring county to West Virginia, we see the contrast of that county's trend to the national in Virginia as a whole, from 8 deaths per 100,000 to 32 in 2015, double the state's and country's rate. The country's increase was from 6.2 to 16.3, and Virginia's was from 5.6 to 12.4. Now let's take a look at the demographics of this population. In 2000, the age range was mostly between 35 and 44 years old, 66% male, and all races except Hispanic were on the rise. But as you can see, non-Hispanic whites, represented by the red line, rose the fastest and highest from 6.3 deaths per 100,000 to 20.7. Now let's see 2015. The largest age range has moved up to the next range of 45 to 54, but if you look, the whole middle bracket of 25 to 64 has really risen. If I click on each of the age bars, the male population tends to have higher overdose rates than the females, except in the youngest and oldest ranges, which are also the age ranges that have a higher death rates in the non-Hispanic black population, the blue line. The other age ranges have higher death rates in non-Hispanic white population. Now that we have looked at the national overdose problem and understand more about it as a whole, let's look at some other information that could help states understand more about their problems and where to potentially start their efforts. On this national map, we are looking at 2 things. In this case, overdose deaths and opioid claims. The scatter plot at the bottom allows you to see exactly where the states fall in comparison to one another on these metrics. It also serves as a color legend to the map. The darker blue means more opioid claims per patient, and the darker red mean more overdose deaths. The darker purple mean more of both. So let's look at states with the highest propensity of both. To see the number of overdose deaths and opioid claims prescribed, you can hover over the dots in the scatter plot. In this case, they are West Virginia, Kentucky, Oklahoma, Tennessee, Utah, Indiana, and Missouri. Let's focus on West Virginia. If we hover over the state, we see that they had 35.5 overdose deaths per 100,000, and the average opioid claims per Medicare patient was 1.081. That doesn't mean every Medicare patient had an opioid claim, but that many had more than one, so it averaged out to 1 per Medicare recipient. If we want to see what percentage of Medicare patients actually had a Medicare prescription, we can change one of the metrics in the report. Here, I will change opioid claims per patient to opioid patient percent. We can see that 25.7% of the Medicare patients were prescribed an opioid, so that means many patients were prescribed over 4 prescriptions. I'm going back to opioid claims per patient. Let's go down into the counties of West Virginia. Again, the darker blue means higher opioid claims, and the higher red means higher overdose deaths. You can see the counties that are close to Ohio, Pennsylvania, Kentucky, and Virginia are high in both prescription rates and overdose deaths. So strategies will not only have to include the core state, but surrounding counties that may have contributing factors. What are the treatment facilities available to these vulnerable counties? We are going to look at Monroe, West Virginia, on the border of Virginia. We can see there are no facilities in Monroe, but by expanding the map out using the negative sign, you can see that there is a facility over 2 counties away in West Virginia and some to the east in Virginia. Are there enough facilities to care for these populations, and can patients from West Virginia go to Virginia facilities? You can click on the surrounding counties to see the number of prescribers to the number of facilities. And we know from the above that these are high overdose death areas and therefore with a high user population. Lastly, let's learn more about the prescribers in Monroe County. Again, we offer peer comparisons. These prescribers are compared to their peers at the national level, the state level, and at the county level. Those rising to the top fall into the highest quartiles of prescribing, highlighted by the dark blue color. Let's expand the top 3 prescribers, which are all family practices, and see the difference in variation on the percent of patients being prescribed an opioid, the number of prescriptions per patient, and the number of days prescribed. You can see a big difference in all those numbers just comparing these 3. Dr. Canterbury prescribes more opioids than both her peers together. 44% of her patients, over 4 prescriptions per patient, and over a 121-day supply. Dr. Hag has a slightly lower risk score, yet he prescribes roughly half the number of patients and far less than half the prescriptions and days. In addition to being able to understand where the overdoses are occurring and how prescribing rates may be playing a part, being able to understand if help is available, what prescribers may have to be educated on the negatives of overprescribing opioids, and how counties and neighboring states can influence our population are all critical factors in starting to explore the opioid epidemic. Next steps would be for the states to add more detailed, expanded data to answer the next level of questions and to track efforts with a mission to save constituent lives. Need help? Come visit some of our other visualizations at bnlconsulting.com/portfolio.